Our lines of business, we have 3 of them. The first we want to talk about is Priority Partners, which is a managed care organization through the state of Maryland. It's one of the 7 MCOs the state created, including Maryland Children's Health Insurance, the adult program, which most people just call Priority Partners, as well as Primary Adult Care, which is known as PAC. Owned by Johns Hopkins HealthCare and the FQHCs jointly in Montgomery County, that's Community Clinic, CCI. Currently, we have over 185,000 members, and we're one of only 2 statewide MCOs. Priority Partners Health Choice is for children, families, pregnant women that qualify through Maryland Medicaid. They offer visits with primary care providers as well as specialists. X-ray screening, lab tests, dental and vision is taken care of through various services within the state. Substance abuse treatment is available, and like our other lines of business, access to our care management programs. They offer visits to urgent care centers as well as a low-cost prescription program. PAC is for adults 19 years and older. Basically visits with a primary care provider as well as outpatient services. Basic x-ray screenings and lab tests. Dental care, again, through the state. Substance abuse treatment. Access, like our other lines of business, to care management programs. Vision and podiatry care for diabetes. And emergency rooms, but no real specialty care. EHP, which the employees of Suburban Hospital have, as well as the JHCP, Johns Hopkins Community Physicians locations throughout Montgomery County, they all have EHP. It's a self-funded health plan with over 50,000 members statewide. In Montgomery County, about 2,500 people as we speak today. The employers are Johns Hopkins entities as well as other regional affiliations. All packages are governed by ERISA regulations, and it's an easy plan to belong to, I think, as most of you know. Doctor's visits, outpatient services, inpatient services, maternity care. We have 14,000 providers statewide, 30 hospitals. Out of the state of Maryland, they use the multi-plan network, which has over 695,000 providers and 3,500 hospitals, including the major ones in Washington, D.C. Dental coverage is through United Concordia. Pharmacy coverage through Caremark, that's CVS. Behavioral health services, care management programs, again, like all of our lines of business. And health coaching service to help people not only to be more healthy, but to have better lives and to make life improvement that will improve your health. USFHP, the U.S. Family Health Plan, is through the Department of Defense as a designated provider for TRICARE. It's TRICARE Prime, offering benefits to active military families as well as retired military. In Maryland, we have over 30,000 members that have USFHP. The main primary care group is the Johns Hopkins Community Physicians locations, and then they'll seek specialists within the community for their specialty care. There are 17 JHCP locations throughout the state of Maryland. We have new ones in Montgomery County. The main one that we've had here is at Montgomery Grove for primary care. But again, growing as we speak, particularly in Bethesda and around Suburban Hospital. Recently, we've expanded USFHP into southern Pennsylvania through Wellspan, excuse me. And we continue to try to grow the network for USFHP, as that is an expanding program that we do have because of BRAC, which is coming to the state of Maryland, which should increase the number of USFHP members we see. A little bit about how USFHP is lined up within TRICARE. You can see that It's under TRICARE Prime, which is the managed care program, and the managed care part of TRICARE. If you have a TRICARE contract, it's not acceptable then for you to see USFHP patients. You need a separate USFHP contract to see USFHP, which is TRICARE Prime, but the TRICARE Prime, the regular TRICARE does not apply to USFHP for claims. USFHP has doctor visits, outpatient services, specialist services, and certainly functions as our other plans. You will generally, if you're a specialist, see a referral from a community physician's JHCP when a patient comes in to see you. The only things that don't need a referral are routine vision care, basic lab tests, and basic radiology. All of the other things are going to come with a referral to your office. Vision care is through the Wilmer Eye Institute or Block Vision. Dental care through United Concordia. Prescription drug coverage through Rite Aid. They have behavioral health as well as care management like our other health programs, and a health coaching service, as we saw with the HP, which also offers a plan really to improve a person's life.